Hello, everybody, and welcome to Community Conversations. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System. And today we are going to be talking about the importance of lung cancer screening. As you may know, it is Lung Cancer Awareness Month. And so to dive into this issue, explain a little bit more about the importance of screening and then really how we help folks with whatever that screening turns up are my two friends who are joining me here today. Doctors, thank you so much for joining me. Closest to me is Dr. Mark Widman. He's a thoracic surgeon with the Carol G. Simon Cancer Center at Morristown Medical Center, part of Atlantic Health. And next to him is Dr. Fred Cerrone, a pulmonary medicine specialist with Atlantic Medical Group Pulmonology. He is also a repeat visitor here on Community Conversations, so our loyal viewers may remember him from his other appearances. Doctors, thanks so much for joining me today.
Thanks for having us.
Yeah, thank you very much.
All right, so folks, just in case you're new to Community Conversations, the doctors and I are going to chat, but you have a role to play in this as well. If you hear something you want a little more info on, or maybe you have a question about something on topic, please, that we haven't gotten to yet, just put it there in the chat function and we'll try to get to as many of those as we can. We got a couple sent to us already, so we'll touch on a couple of those as well. You miss any part of this? Don't worry, it's being recorded to our YouTube channel, so subscribe to our YouTube channel where you can see this and all of the great community conversations we have with all of our amazing doctors. So that all having been said, let's jump right in. So as I mentioned, it is Lung Cancer Awareness Month. And so I think we felt, and thank you so much to you guys for joining us on this topic, to try to raise awareness about the importance of screening. For either of you who want to take it, and we'll give you both an opportunity to respond, let's talk a little bit about the importance of screening and why we're spending this time today talking about this important topic. Whoever wants to go first.
I'll defer to you.
Okay, so, thank you for having us to talk about lung cancer awareness and lung cancer screening. So, we know that lung cancer, a lot of people don't know actually, is the #1 leading cause of death from cancer, in this country. And just like breast cancer, prostate cancer, there is lung screening available, and we just want to make sure people are aware of that. There are certain criteria for that we can go through, but we found that these patients who go through this lung screening, it makes the lung cancer much more curable disease for those patients.
Dr. Widman, what stands out to you when folks say, maybe I'll go get screened, maybe I won't? What's your sort of like elevator pitch, if you will, to sort of enforce for people about the significance of lung screening and what it does for us?
Well, I think there's a lot of hope in the patients who do get screened who unfortunately do have suspicious nodules or, even a cancer discovered, that the vast majority of people whose tumors are discovered through a screening process are in fact, eligible for curative intent therapy, which is very different than patients who are found incidentally who present later with more advanced disease.
On down the line.
Much further down the line. So screening does save lives, and that's, I think, our biggest message that we want to convey today. And it's painless and it's safe.
I want to pick up on that, right? What is the process for screening? How you say it's painless? I was going to ask if it was invasive. It sounds like the answer to that would be no. But what goes into a lung cancer screening?
Yeah, it's actually pretty simple, really. It's pretty amazing what we do now. The CAT scan, which for those of you who don't know what a CAT scan is, basically an imaging technique. And the whole process, literally from the time you lie down on the scanner, is probably about 60 seconds.
Wow.
Yeah, you don't need any dye, nothing. Just lie there for 60 seconds and it's done. 60
seconds to have insight into something that could have years-long repercussions if you're unaware of it.
Right.
Who should be screened? When we talk about the types of patients for whom this makes the most amount of sense, who are we talking about here?
Yeah, so basically, there are criteria for this, right? So it's basically anyone between the ages of 50 and 77 who smoked, on the average, 1 pack a day for 20 years. So if you smoked half a pack a day for 40 years, it's the same thing. Okay. And either still smoking or stopped within the last 15 years, then basically you are a candidate to get lung screening.
So even if you cut it out, you still need to keep an eye on
Absolutely.
These things. Dr. Widman, okay, so walk us...
I just want to follow up on one point of that is that that this is something that is covered by insurance. This is not an out-of-pocket cost. It is now, standard recommendations for these groups of patients covered by Medicare and regular commercial insurance as well.
Critical information for many of our
patients. And the other point we should point out is also, just like mammograms and prostate cancer screening, it is an annual screening, right? So
okay.
many times the initial scan is negative,
Right,
but
shows
we've
nothing.
seen where subsequent scans that we pick up these lung cancers. So it is important to stay in the program.
So it sounds like you're encouraging patients. This would be something they need to build into their regular healthcare
Absolutely.
regimen. So to
Correct.
speak. Okay, Dr. Whitman, what happens if you see something on a scan that is concerning? What's the next steps that a patient might finding themselves go through?
Well, if there is an abnormality, I mean, the first step is the patient needs to review those findings with their physician, and then if their physician, is comfortable, then they will advise either next steps of referral for evaluation by a specialist, either a pulmonologist or potentially a chest surgeon, or we also have a lung screening program at Atlantic that we have nurse navigators that can help direct them to our pulmonologists, and based on certain risk factors, the next steps might be repeat imaging on a shorter term interval. It might be some sort of biopsy. It really depends on what the findings are.
That's my cue. You may see a phone number in the chat portion of your window. That is a really useful number to get in contact with the lung screening program here at Atlantic Health System. If it's not there yet or you don't see it, I'll read it out to you. 844-228-LUNG, which happens to be 5864. We'll repeat that a little later in the program, and of course, like I said, we'll put it in the chat. And of course, I encourage you to go to our website, atlantichealth.org, where you can find out information about not just these two wonderful physicians, but all of our physicians and all of our various clinical offerings. Dr. Whitman, one follow-up on that. In the event a surgical intervention were necessary or a more invasive treatment protocol were needed, what in comparison to other cancers, how effective are we at treating lung cancer? It doesn't have to be specific statistics if you don't have them, but broadly speaking, is it a treatable thing?
The majority of early stage lung cancers are curable, and they can be treated often with surgery, sometimes with other techniques, such as radiation. And prognosis for lung cancer is improving, in all stages of disease. There's been great advances in some of the novel chemotherapeutic and immunotherapy options. So even for patients with more advanced disease, we're seeing longer and longer survivals. So it's very treatable and often very curable when found in the early stages.
Got to be an exciting time to be involved in care for these patients, to have new options, to have greater abilities more than ever. It must be very rewarding for you to be able to provide that level of care for patients.
Oh, it very, very much is. And in fact, one of the things that we've seen a real revolution, not just in our diagnostics, but in our ability to do biopsies minimally invasively or do staging analysis to see where the tumor might or might not be. All of this has really advanced remarkably, including our surgical techniques, which have all evolved into very minimally invasive approaches.
Wow. Dr. Serrani, a question for you, and this is from one of our viewers named Melissa. Melissa, she didn't smoke, but she spent a lot of time around secondhand smoke because her husband did.
Yeah.
Is she a candidate for a screening? Do you recommend folks who have been exposed to large amounts of secondhand smoke get screened as well?
Yeah, so great question. So unfortunately for the formal lung screening program, it's really for smokers.
For smokers, right.
But there are programs available, and you can call the same number, where there are scans available if they are concerned. Certain criteria for secondhand smoke, radon exposure, things like other possibilities for or causes of lung cancer.
What's the first stop on the train for folks who are interested in doing this? Is it working with your primary care physician? Is that who you kind of start with and then get connected to the broader?
Yeah, usually it's a discussion with the primary care physician about about lung screening and about the program, and our AMG and other physicians in Atlantic are fully aware of the program. So it's just that conversation about, hey, I smoked, do I qualify for the lung screening program?
Interesting. Christina has a question. Is there a difference in level of concern with regard to vaping or cigarettes? Is it the same? Should you consider one to be equivalent with the other when worried about your overall lung health, or is it not? These are not quite equivalent, or do we not have an answer to that yet at this time?
So we don't have that answer yet, right?
Yeah.
Vaping is relatively new,
It's a newer
but
thing, right?
as I tell my patients, breathing in hot liquids into your lungs is probably not a good idea. So
Compared to regular air or oxygen?
Right,
Yeah,
right, so.
Good point. So I wonder, we have another question here from Deborah, who is basically wondering, if you had a short list of things that were the healthy, and this sort of dovetails just off the answer you just gave, the healthiest things you can do for your lungs to keep your lungs healthy. Imagining quitting smoking would be a good one.
Yeah.
But are there other things that you think about when just trying to remain healthy in general?
Yeah, I mean, the best thing you can do for your lungs is use your lungs, right? We basically use it or lose it is basically what we tell them, right? It's, even people who are short of breath, who feel like, I'm having trouble breathing, we really encourage them to exercise. Any kind of exercise, any kind of movement is good for your lungs, right? We have for our advanced patients with lung disease like COPD, we have pulmonary rehab programs. We have other ways to help them, but it's get up off the couch and move. That's what we tell everybody.
Good to know. So one of the things we try to do on the show is you never really know quite when folks are jumping in. So I want to just reboot and give you folks watching at home just another look at that number for the lung cancer screening program here at Atlantic Health System. It's 844-228-LUNG, which is also 5864. Again, you'll be able to find that in the chat section on your screen. But of course, we encourage you to reach out and connect if you are a current or recent or former smoker at all, to try to get a handle on this. So, Dr. Widman, as we kind of come back around again, I want to make sure our viewers understand the most important takeaways of what we're trying to do here. And that really is stress the importance of knowing the facts about your health. And that, in this case, is through screening. So if I could impose upon you one more time, let's sort of reboot and take a second again to remind folks about why screening is so important and what you would encourage folks to do.
Well, I think, again, just to reiterate, finding lung cancer in its earliest stage gives people the highest success of being cured. And unfortunately, lung cancer is silent. It does not cause symptoms until it's much more advanced.
Really?
So people don't feel pain, they don't have shortness of breath, they don't have cough, they feel fine, they're breathing normally. So there are no symptoms for an early stage tumor, but that's when it's curable, much more readily. So
the only way to really know then is to go in
and get a screen. And the other thing is the X-ray misses probably 75% of these small nodules. A routine chest X-ray is not sufficient, and people who are at risk should get the screening CAT scan, not just an X-ray.
Good to know. All right, folks, again, if you missed any portion of today's program, I would encourage you to check out our YouTube channel. You can subscribe there to it, where I think we're in our 40s in terms of total number of episodes. So there could be any number of topics of interest to you there. I encourage you to subscribe and check it out. Doctors, any final thoughts to share with our audience as we wrap up today's program? It is November, Lung Cancer Screening Awareness Month. So any pieces of advice or final words you'd like to share with our audience as we wrap up today's program? Whoever wants to go first.
No, I would just go back to what Dr. Widman said, that saying that, again, like any screening program, we can really help you. And it's not something to be afraid of or scared of, that we just want to find it early and cure it. That's basically the idea.
And quit smoking would be a good
and quit smoking.
Always a good piece of advice there. All right, Dr. Mark Widman is a thoracic surgeon with the Carol G. Simon Cancer Center at Morristown Medical Center, and Dr. Fred Cerrone is a pulmonary medicine specialist with Atlantic Medical Group Pulmonology. Thank you both, doctors, for joining me today.
Thank you for having us.
All right, folks, thank you for tuning in to this episode of Community Conversations. My name is Luke Margolis, and we will see you next time.